Researchers are developing a new method for forecasting flu outbreaks more than a week in advance. Here's how they're doing it and how it could eventually affect you.
You need to watch yourself.
Bernard Gibson came to Florida Hospital with an early case of the flu.
I couldn't breathe. I couldn't even breathe. I thought I was going to die.
Bernard told me he would have done almost anything to avoid getting this sick, including paying attention to a flu forecast.
And watch the people you be around. Keep your hand washed. Keep your mouth and nose covered.
Scientists have just developed a computer model for predicting flu outbreaks weeks in advance. Researchers at Columbia University and the National Center for Atmospheric Research focused their study on winters in New York City between 2003 and 2009. Now, the formula used data from the Google Flu Trends project, which estimates flu outbreaks based on the number of flu-related searches in any given region.
What they amazingly found was that it was just as accurate as the CDC's model, which used doctors and hospitals and laboratories to report cases of flu. Then this group took a step further and decided to combine it with weather data and winds aloft data and that type of thing to see if they could predict the spread of flu across the country and across the world. And it appears to work.
It could give health departments a 5 to 7 day lead on an outbreak.
On a statewide basis, if we have and anticipate different parts of the state being impacted at a greater amount, we can also shift resources. You could theoretically shift supplies of Tamiflu, the medications to treat it.
And a flu forecast could signal hospitals to ramp up staff.
But it's really not going to convince anyone to go out and get a flu shot, and it probably wouldn't have enough time to take effect if they did. So the practicality of it, I'm not sure.
Flu, by the way, has arrived in Tampa Bay. Dr. Holt says it is sporadic, but at least one hospital is reporting cases of influenza B, which can leave a person sicker longer. For more information on this story or any of my health reports, head over to my Facebook fan page. Just look for Linda Hurtado, WFTS, under Pages.